Afan Wachinyankali, and I do work as Marketing and Public Relations Officer at Islamic University in Uganda, and I sit at Females Campus, Kabojja. Now, today, Alhamdulillah, we'll come back from the night, the 27th night that we consider, most of you, according to the sheikhs, they say, ekire kyabirimu omusanvu kye baateekako nnyo essira okuba nti kya Lailatul Qadr. Anyway, leero tuli ku Females Campus Kabojja era nga tugenda kuyiga ebintu bingi. Abantu bangi batawanyiziddwa kye bayita ulcers, abantu bangi tebamanyi kye bayita chicken pox, abantu bangi endwadde empitirivu. Naye as I said nti abantu bange bano babeere basirifu ate nga bagumiikiriza ekyo ekintu kijja kunkolera bulungi okuba nti I know they are busy batabulatabula sibitegeera bagala kunkuba mpiso saawa zino simanyi naye nga they are very good students. Of course some others are in lectures, but leero bano betusanze wano mu skills lab be bagenda otusomesa ku ndwadde ez'enjawulo. Tulabe nga bajja kusomesa mu nnimi ez'enjawulo. Njagala mbategeeze nti ebintu bingi siri musawo naye nga nasomako ekitonotono. Naye mbategeeze nti ebintu bingi tugenda okuyiga ng'abantu abava mu kisiibo, abantu bangi banywedde ebidagaladagala, mulina kye bayita self medication which is not good. Bajja bayigiriza ebintu bingi. Wano abaana bano boolaba ojja kwebuuza ali mu uniform ya kiragala wa koosi ki, ali mu uniform ya bbululu wa koosi ki, bonna bonna bali mu busawo, naye ekibaawula nti bano abali mu green bakola certificate ate bano abali mu blue bali mu diploma. Ayinza okwambala blue nga ali mu diploma direct oba diploma extension. Jukira twagamba nti admissions in progress, mujja ne mukola interviews ne mugenda mu maaso n'osooka olaba. Kati kyogenda okulaba bwe bujulizi obugenda okulaga nti abaana bano basoma okusinziira mu myaka gyabwe. Nja kusooka mpita y'omu I think he's a former president. I don't know whether she's still a president. Why you Nasinam? Nakayiwa Lorita, take the podium as I introduce your friends. You know, nebuuza kino ekintu kyeki omuntu ayinza okubeerayo nga tumanyi nti mu lubuto lwo lufaana bwe luti ng'okanya kuteekamu KFC, McDonald's, emmere ya mama naalongo wali mu katale naye nga tomanyi nti muno okola ki mwegenda. Naye bajja kutunnyonnyola omukyala ayonsa ayinza okulaba nti this is the bbeere mwana bw'ayonka atya naye bajja bitusomesa byonna byonna. Right now let me introduce our first person, Sokoveyo Katono, who is Lorita Nakayiwa. And Rita is the president of UNASNAM. Agenda kutuweereza mu lulimi Lungereza. You're welcome, please.
Thank you very much, dearest MC. My name is Nakayiwa Lorita, a nursing student at Kabojja School of Nursing, IUIU Females Campus, currently in my second year, second semester. And as we all know, health is wealth. Today, we are going to discuss a topic that is experienced by many, but is often misunderstood. This is peptic ulcers. As many of us would call it, stomach ulcers. Peptic ulcers comes as a result of a variety of conditions. First of all, what is peptic ulcers? Peptic ulcers is a condition that arises as a result of mucosal damage to the mucosal lining of the stomach and the duodenum, leading to the formation of ulcers. Ulcers are wounds in the first place. How does one get ulcers? Peptic ulcers come as a result of a bacteria known as H. pylori. H. pylori irritates the stomach lining, increasing the risk of stomach ulcers. Then we have excessive smoking. Cigarettes have a substance known as nicotine. Nicotine irritates the stomach lining and increases the production of stomach acid. Then we have alcohol. Excessive alcohol consumption is very, very dangerous to our health as well as to our stomach lining. It inflames the stomach lining as well as the duodenum, therefore increasing the risk of getting stomach ulcers. Then we have another cause known as, okay, many of you may not know what the stomach may look like, but it's this. Let me dismantle this. This is our liver. Then these are the intestines. So the stomach is this component here. It's under the liver, above the ileum, which is this. And these are the intestines, okay? So ulcers affect the stomach lining. This in the inner layer of the stomach. These are wounds that will develop if you smoke too much, if you smoke too much, if you take too much alcohol, if you eat poorly, as well as stress, especially chronic stress. How does a person know that they have stomach ulcers? How does a person know that they have stomach ulcers? Stop. Okay. How does a person know that they have stomach ulcers? This can come with epigastric pain. When I talk about epigastric pain, this is pain here. It's called the epigastric area, also known as the upper abdomen, the upper area of the abdomen, okay? And then we have pain that comes with food intake. Like as you eat food, you feel pain, okay? Then we have nausea and vomiting. When I talk about nausea, this is the urge to vomit. Then we have bloating. This is the feeling of gas in your stomach, in your abdomen, sorry, okay? But peptic ulcers is very, very preventable, though many people may just take it lightly. You can start by eating on time. You can start by avoiding smoking, avoid excessive alcohol consumption, and avoid prolonged use of painkillers. When I talk about painkillers, these are medications that you use to relieve pain. For example, aspirin, ibuprofen, among others. In conclusion, peptic ulcers are very preventable with the right lifestyle choices. Avoid smoking, avoid excessive alcohol consumption, and eat well. And also, if symptoms persist, please attend to your nearest health center. Thank you very much. Once again, my name is Nakaiwa Lorita, a nursing student at Kabojja School of Nursing. Stay healthy and stay informed. Thank you.
Okay, thank you so much, Your Excellency Lorita Nakaiwa. Babalaze, batupangulidde omuntu yenna nesisiwala muli mutima. Batulaze amawugwe. Mbadde simanyi nti ate omala okujjawo olubuto luno ate waliwo ebintu ebirala ebibeera emabega. Ffe we twakulira twali tulowooza nti olubuto luno lulinga saka, luli empty, gwe emmere gy'oteekamu gyekola ki? Egiwa. Naye bino bisankwa Islamic University in Uganda Females Campus Kabojja, ate nga babayita okwewandiisa mu busawo. Mujje musome nursing and midwifery obeereko nga Lorita. Ndowooza okumikisinga obulungi nja kuyita mukyala Kayaga babiri mulongo ojjo tuwe mu lulimi Oluganda obeeko nekyotusomesa inshallah. Sembera wano oba oli awo n'omuyambi wo. Ani muyambi wa babiri? Nza Sembera. Kazindalo kako.
Assalamu alaikum wa rahmatullahi wa barakatuh. Mwasuze mutya abalabi baffe abalungi. Erinnya lyange nze Babirye Kayaga Husna nga ndi muyizi ow'omwaka ogwokubiri, ndi mu semester yange ey'okubiri nga nkola certificate in general nursing ku Islamic University in Uganda Females Campus Kabojja School of Nursing and Midwifery. Olwaleero tugenda kwogera ku stress. Ffenna wano twali tubaddeko stressed. Stress kyeki? Mu Luzungu tugamba it is a natural psychological response to a perceived threat. Psychological kikwatagana ku bwongo buno. When we say psychological, tuwa togera ku kintu ekikwatagana ku bwongo kuno. Bw'oba ekintu ekikutawaanyiza obwongo bwo bureactinga butya oba omuntu areactinga atya. That is what we mean by the natural response. It is natural or it is normal, but when prolonged, it can have negative effects. Tibeerawo eri fenna tufuna stress. Naye stress eno bw'esukkirira ebeerako ne effects ku bulamu bwaffe ng'abantu. Then tuyina types oba ebika. Tuyina acute ne chronic. Acute stress, this is short term and caused by a specific event or situation. Short term kitegeeza kabeerawo kaseera katono ne kimala ne kivaawo, and it is caused by a specific event. For example, pressure to meet deadlines. Abaana abasoma oyina coursework tonnamumala, lecturer n'atera okuyingira mu class. That stress you feel gye tuyita acute. Oba bakubidde nti muganda wo mulwadde naye tunaatuukayo bulungi confirminga. Stress gy'ofuna awo gye tuyita acute. It is short term. Then ne tuba ne chronic. This one is long term or persistent stress. Persistent means kibeerawo ne kiremerawo nga tekivaawo, right? For example, persistent financial problems. Abazadde abali eyo ng'omwana wo buli watuuka okudda ku ssomero obeera tonnaweza school fees. Oyo stress omufiiringa buli taamu. That is persistent, that chronic stress. It doesn't go away. Then ne tubeera ne manifestations. Manifestations are signs and symptoms. Kiki koolabira nti omuntu alina stress? Tulaba tutya? First of all, fatigue. N'owulira obukoowu mu mubiri guno gwonna naye si nti ova kulima oba obadde olina ky'okola naye n'owulira nga okooye. Then we have increased heart rate. Omutima guno n'owulira nga gukuba nnyo naye nga tova kudduka tova kulinnya kasozi naye n'owulira nga omutima guno gukuba nnyo abnormally. Then we have sweating and shaking, n'otuuyanirira no kankana. Then anxiety, kuno kubeera kweraliikirira nnyo ekiteetaagisa ngamba school fees w'omwana ngenda mujja wa siina mulimu, something like that. Then we have social withdrawal. Mu baana abasoma woba oli stressed oyinza okwejja mu banno n'ogenda n'otulayo mu hostel wekka ng'oli mu kulowooza ku nnaku gy'oyitamu. Then we have difficult in concentrating. For example, oli mu lecture naye nga bwe basomesa tobitegeera obwongo buli wala nnyo siina futaali obudde obutuuka ngenda kukola ntya. So zezo signs ze tulabirako nti omuntu ali stressed. Then we have causes. Biki ebireetera stress ono gwe twogerako? We have work related, work overload. Okubanga omuntu omu olina emirimu mingi gy'olina okukola ne ku baana abasoma ng'olina course units 6 zonna coursework tonnamumala, that could be work overload. Then financial stress, kino twakyogeddeko dda, okubanga tolina ssente olina ebintu by'olina okukola naye tolina ssente zigenda bikola. It can cause stress. Then relationship stress. Obanga watabuseemu n'omwagalwawo ne mukwano gwo oba olina obuzibu mu famire yo nakyo kireetera stress. Then health stress. Okubanga weeraliikirira ku bulwadde oba bakugambye olina ki? Olina cancer, ogenze mu ddwaliro ne bakugamba olina cancer. That stress, that worry gy'obeera nayo, it causes stress. Then we have environmental stress, noise pollution. People who live in slums, obeerawo nga buli kaseera people are shouting, abakatale, abaati, nakyo kireetera stress. Then we go to management. Kiki ky'okola bw'obanga oli stressed? The first thing in management, acknowledge that you are stressed. Kkiriza nti kati ndi stressed. Then what's next? Take a deep breath. We all know how to take a deep breath, right? Then lifestyle changes. Do some exercises. Go for swimming. Do some yoga. Have enough rest. Wummula ekimala. Seek social support. Gendako mu mikwano gyo oba mu bazadde bo obagambe ndi stressed. Okubeerako nabo kiyinza okuyambako okuggyawo stress eyo. Then avoid triggers. Weewale ebintu ebikuleetera okubeera stressed kubanga obimanyi byewale. Then professional help. This one is seeking therapy. You can go to a professional therapist. Then prevention. How can we prevent this stress? First of all, self-awareness. Know yourself. Ogambe kino kinstressinga. This stresses me. So osobola okukyewala. Set boundaries. By setting boundaries, I can also put set priorities. Oba olinawo akawokola mukole ng'obudde bukyali si kubeera ku TikTok, then the lecturer is 5 minutes to the lecture, then n'ojjukira okukola waaka. Set priorities and prioritize them. Then use technology wisely. Woba ogenze ku simu yo, genda ku apps ezigenda okuyamba, right? Togenda ku TikTok. You can also customize your TikTok to show things ebikuyamba. For example, you can customize it okulaba ebintu bya health. You can scroll through the STEM tab. That is something that is actually useful than okubeera ku TikTok agenda okustressinga. Then leisure activities. Join the sports. Do football, do netball, do swimming. We have all those activities at our campus, in fact. So, thank you for listening. That was all about stress. Stress, asobola okuleetera pressure. Like long-term stress. Omuntu wabeera stressed for so long. Chronic stress gye tubadde twogerako eri persistent. Esobola okuleetera pressure. Yes. Yeah, it is not the medical pressure, but mposa abantu bakakozesa nga term. Yeah. Okay.
Okay. Thank you so much for your wonderful presentation. We are still at the Health Symposium, Islamic University in Uganda, Females Campus, Kabojja. We are here and we are trying as much as possible to see that we are looking at different things. Ebintu byetuba tuyitamu mu kisiibo muno. By the way, kyannaku nti omuntu ayinza okubeera eyo naye nga talina information emumala. Naye obanga oli ku TV Salam TV, obanga oli ku Salam TV ng'oli wano olaba, kirungi nnyo okuba nti ofollowinga topics zino ez'enjawulo obeere nga oyiga mu bayizi baffe bano. Nga bwe ngambye nti nja kutabula Kasavu Kanyama, nataka tukuwe na watu wote wafundishwe. Tunakuwa na Waswahili hapa, watu wetu kutoka Bunyoro, watu wetu kutoka Ankole. Sasa Islamic University in Uganda tunasema tunafundishwa nations. We educate nations. So I think omukaikuru yaturebe. Gwaddako omuyambi waje akuyambe yandeko.
Assalamu alaikum wa rahmatullahi wa barakatuh. Amabara gange nnyo Amani Jalia. Ninsomera ha Islamic University in Uganda Females Campus Kabojja. Ndi mwaka gwange gwa kabiri semester ya kabiri. Banyusa kuba nihauza kikindesere maiso ganyu. Banyize kubasomesa aha kirere kebeta UTIs oba urinary tract infections. Zini mkwe habuza kiki kebeta urinary tract infections. Zini zo infections ezikwata system yete yokusensa wa mrujunge weta urinary system zikwata kuruga ha katago mpaka na hali enkali rabira mpaka kugisensa. So mukuserereza kwaitu twagenda kusanga ngo abakazi no bakyasingire kufuna UTIs habo kubengeri abakazi yebasensa, it makes them more exposed to the infections. Nikyakande kindi kisinga kuletereza abakazi kuba baina UTIs okusinga abasaija. UTIs zino blada ya ituite ngaita akatago kaitu ngaita abakazi kata haihi hatinu wetuba twikire kusensa infections oba bacteria ziribatalbata mpaka ha katago kaitu. So examples za UTIs abakusinga zemmanyire walo candidiasis oba candida batu bakusinga bemwita candida. So atoro rotango ina UTIs. Ekikusokera kurango ina UTIs ogenda kufuna okusihibwa abakazi mu bakazi ogenda kufuna okusihibwa hansi ya goko nali tusensera goko ogenda kurayo ebikusiha ogenda kusensa enkale lumo musayi ogenda kusensa wakuba noyika kusensa nohura omuro gwoko hansi noyika nohura no enkadi bule kuraba nohura yomuro ike kwa nikyo nikireti okukenga ngo ina kandido ina kirere kinkiona ojja kufuna okusensereza buli kaire wakamala kusensa dakika 2 enyuma ogarukemo sensere dakika 10 enyuma nogakamno sensa ekena ikuletereza kyo kikole kyango ina urinary tract infections ojja kufuna okurumibwa hansi ha jeteta lower abdominal pain timanya beta omulunyo right hansi ojja kufuna okurumibwa kwingi mbakazi bajja kuba ni barugamu ebi discharges oba nibisananke bisirasira ojja kusanga biri juka bwebodi normal otayina infections eberi ya white awe eri ya cream hata noraba ina infections bigenda kufuka greenish bifuke brownish onokenga ngo ina urinary tract infections so mbasaija bagenda kufuna painful ejaculation bagenda kufuna pain hanskun testicles go hansi bagenda kurayo pain so etereza mtu kuba na UTIs oba kuba na ebirwere by'ogwoko hansi kenyeberoga kubagamba UTIs kwaukana na birwere bya hansi oko diseases zikwaukana na infections diseases tuinamu gonorrhea tuinamu biki tuinamu syphilis then infections just inflammation of an organ just organ urinary tract infections. So the causes is infections of ebiziretereza mulimu ekikusokera kim bacteria ola asakuruga gwakuli najana sensa hatoi aina infections nayo najana sensa bacteria nizikurubata nizigenda mpaka gwakunekia kandi kyo mbakazi kilikia kuwaipinga noruge enyuma nogarura maiso kibi muno bokubo mazire kugenda for long call bagenda kweyamba Frolonko butwena kuwaipinga noruge nyuma nogaruka maiso inakuruga maiso nogaruka nyuma kuba normal flora aligwo ku hansi oba ebitu yamba to keeping at taina the infections bokujukaza ukane ziligwa kuno owa sensa zikwauka neziligwa kuno na hali opamira so bokufuna toilet paper okay wipinga noruga gwa kuno enyuma nali turabizo obuchafu no garura gwa kuno maiso ojja kuba hire normal flora muhire gwa kuno nali obuchafu burugo mugarure gwa kuno maiso nali tusensera kandi bijja kuba bita coordinating okuba mu kisingiro gwokoza akatogo so kinde kiretereza UTIs mulimu kusiba enkali muno nogamba ngena kusensa nkale kulumire saa imno gamangena kusensa saa ibiri atake kikozinga bacteria zikwikala ziro mu munda nizikurwaza kindi kirikya kujwara empali zikukwasire iwe no jwara empali zikukwasire muno tena naho kuhikiza kindi kirikya kujwara empali ziri wet oba ziri mbisi kyo kuzitwara mu kasana zomeho iwe boko ina empali ibiri no jano ziteka munda mkisika nisitafuna hamsana nyinkia kanzono kera no jwara no genda kwa noja kwelwaza infections munye no kunya no butanywa amaizi nakyo kiretera infections so tukusaba kuzetangira tutoba the preventions ekusokera kim tutajwara empali ziri tight tutajwara empali ziri wet to maintaining a good hygiene gwoko hansi juka hygiene yomuntu wena itandikira gwoko hansi tuwepinga bakazi ntruga maiso tugaruke enyuma jwara panty ziri oba underwear ziri za cotton but ziri nkotokoto kandi zitakwasire muno to eating a balanced diet abakazi tuina kunywa muno yogurt kandi to avoiding sugary foods mukumaliriza kwange nyenda kubasima kumpeza matuganyu kandi mwebale muno kutuhagira itwenka isomero lya itu sima muna wazele batu bale kutweta Islamic University in Uganda kuba singa ntaiza universities Islamic University in Uganda singa bino na timbi manyesa alhamdulillah mwebale kutuheza matuganyu kandi in case bintu na bitabu kiro mugene mseeking medical attention because UTIs are preventable. Thank you. Assalamu alaikum warahmatullahi wabarakatuh.
Eto yanzire muno. Abaitu mwena mwamureba yaruga Islamic University in Uganda Females Campus Kabojja. Now we can also call someone asobola okutwaye mu luzungu. Ogenda kusomesa kuki? Pneumonia ndwadde mbi nnyo. Oh, gisomeseko.
Assalamu alaikum warahmatullahi wabarakatuh. I'm by the names of Namtsebi Hannah from Islamic University in Uganda. I'm studying a diploma in nursing direct. I'm in year 2, semester 2. So I'm going to talk about pneumonia. It is a very serious condition. This is the infection of the lung tissues. It can be mostly noticed by severe cough, difficulty in breathing, and also fast breathing. It's mainly caused by infections such as bacterial infections, viral infections, and also fungal infections. It can also be caused when we inhale or breathe in food or substances like water and the rest. So the people who can easily get this infection, they're mostly young children from 6 and below the age of 6 years. We have the elderlies, such as those who are 65 and above. They are most likely to get this illness. Those with chronic illnesses, such as diabetes, their body is not strong enough to fight these diseases, so they can easily get pneumonia. Those who have weak immunity, such as those of HIV patients, their bodies aren't strong enough to fight against these diseases. Those who have poor nutrition, so if you're not eating a well-balanced diet, you're most likely to end up with these infections. So it's a very serious condition. So when somebody gets pneumonia, these germs enter. These germs, it can either be through the mouth when you breathe in these germs. The moment they reach the lungs, they're going to irritate the lungs. They get inflamed, they get swollen, you get pain and whatsoever. So it is a very serious condition. Well, you can easily notice this pneumonia. First and foremost, the most obvious signs, there is going to be cough. Sometimes you can end up coughing out mucus. It can either be greenish mucus or yellowish mucus. You're going to get chest pain. It's going to be quite severe. This chest pain is also going to also be brought about with difficulty in breathing. Because sometimes you're going to have fast breathing. Your heart is going to pump at a very fast rate. You're going to have we're going to have other issues such as fever, very, very high fever of like about 36 degrees Celsius. We're going to have other issues such as wheezing. Wheezing is one of the most ways of identifying pneumonia. So basically, if you find somebody breathing like, it's okay. So that's one of the most ways of identifying pneumonia. So please, if you notice these things, it is a very serious condition. You really need to go to the nearest health center for medication so that it can be treated early before things get really serious. So it can end up becoming it can also lead to complications. So we can end up with issues such as respiratory failure. Here, basically, your lung tissues slowly die away. So the moment we enter such stages, there is no coming back with treatment. The treatment won't bring your lungs back to the way they normally used to function. So it really needs quick treatment. We have other issues such as sepsis. As you can see here, the lungs are being supplied with a lot of blood just to get the oxygen in and out. So sepsis here, basically, you will find the bacteria that was infecting the lungs, you're going to find it in your blood. And when the bacteria is in the blood, it's going to affect other organs, such as the heart. Therefore, you end up getting heart problems. You're also going to end up with pleural effusion. This is when the lungs are surrounded by a lot of fluids, making it even more difficult for you to breathe. But the good thing about this is that pneumonia can be prevented. So we can prevent pneumonia by getting vaccinated with influenza vaccine and PCV vaccine. So please, those who have not yet vaccinated your children or have not yet received the vaccine, please go and get it as soon as possible. Then we can also prevent it by distancing ourselves from those who already have the infection, because it can easily be inhaled in if at all they find themselves coughing it out. It can also be prevented by maybe proper sanitation. You cough into your armpit, because it's more appropriate to cough in such a way so that you don't spread the infection to other people, for those who are sick with it. You also need a proper balanced diet. Those who have chronic diseases or weak immune systems, we have to find proper ways of managing them such that our bodies cannot quickly get the infections. Yeah, so basically, that's all that I have to present. In conclusion.
Thank you so much. Namtebi?
Namtebi.
Wangabi?
Yes.
Okay, Namtebi Wangabi, thank you so much. Enga, you are very tall. I should also, anyway, as we look forward to extending our presentations, tugenda kudda ani halirudawa. You come Shadia, you have 3 minutes, then after tugenda kudda ku bajita batya CPR. Okay, tugenda kudda ku CPR. Chikwese dachikala 2-3.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Musimenta Shadia. I'm a student nurse at IUIU Islamic Campus, Females Campus, Uganda. I'm in year 2, semester 2. I'm going to be educating you about monkeypox disease. Many of you have heard about monkeypox disease, but some people may not know what it is. So I'm here to briefly teach you about what monkeypox disease is. So what is monkeypox? Monkeypox is a rare but potentially life-threatening viral illness caused by the monkeypox virus. The monkeypox virus belongs to the orthopox virus genus, and this includes other viruses like the smallpox virus, the chickenpox virus. So that is why monkeypox has somewhat the same symptoms and signs as those of smallpox, chickenpox, and all that. Monkeypox is mainly found in the Central and Western African countries. That is where monkeypox is mostly found. And monkeypox was first detected in 1958 in a colony of monkeys that were being used for research in Denmark. That is how it got the name monkeypox. But later the name was changed to Mpox by the World Health Organization due to the stigma that was attached to it. So briefly, that is what monkeypox is. It's just a viral illness, it's life-threatening, and we've seen a bit of the history of it. So yes, I think now when we talk about monkeypox, at least the listeners can know what monkeypox is. So how is monkeypox transmitted? The first way that monkeypox is transmitted is by direct contact. By direct contact, I mean physically touching someone who is sick, who is infected with this virus, by hugging, shaking hands, just any type of physical contact with a person that's already infected by the virus, you will get infected. And then the other mode of transmission is indirect contact. This means touching maybe surfaces, clothes, beddings, utensils that have been used or touched by someone who is infected. So if it's a bed and someone was sleeping there, that person had monkeypox, you're also very likely to get, if you sleep in the same bed, you're very likely to also get monkeypox. That is indirect contact. Then another mode of transmission is animal to human transmission. This means handling or eating uncooked meat from an infected animal. Monkeypox was first discovered in the DRC, Democratic Republic of Congo, and it was found that people used to eat the meat from monkeys. So this is how they got the monkeypox. So handling meat, uncooked meat, not very well cooked, well done, all this is animal to human transmission. Then the last mode of transmission is droplet infection. This is by respiratory droplets, coughing, sneezing in presence of other people. If I have the monkeypox virus and I do that, I will give them the virus.
Then the signs of monkeypox, we have fever, headache, general body weakness, fatigue, muscle aching. We also have flu-like symptoms, cough, and the rash, the monkeypox rash. Some people may get these other symptoms before the rash. Other people may get the rash before the other symptoms. It basically depends on your immunity. But that is how you can know that someone has monkeypox. And then lastly, I want to tell you about the prevention. The prevention basically is good hygiene, hand washing, protective gear, gloves, masks, getting vaccinated with the mpox virus, and all that. So I think now people are aware about what monkeypox disease is. Thank you for listening.
Okay, thank you, Musimenta. Shadia, Musimenta means how will I appreciate him or her? But of course, there's a way of appreciating. Now, there's something that is very common that we haven't yet given time. Kyetawadde budde. Abantu abangi bazirika, simanyi biki biki. Sizirikangako alhamdulillah, nebaza Katonda. Ne kati nassaka agenda kutunyonyola mu Luganda. Ne banne omuntu ono abeera atya. Genda mu maaso.
Thank you, Mr. Fan. Yes, assalamu alaikum wa rahmatullahi wa barakatuh. Abawuliriza baffe era abatulaba nze mutya. Amanya mpitibwa Nasaka Lukia nga nsomera wano ku Islamic University in Uganda Females Campus Kabojja. Nga ngenda basomesa singa oba osanze omuntu nga azirise nga ali unconscious okola otya. I'm having here my helpers bagenda kuba banyambako. So in case osanze omuntu nga azirise okola otya. First of all,
You said what a woman can do, a man can do, but
yeah.
it's now heavy for you.
So bw'oba osanze omuntu nga azirise okola otya. First of all, ogenda soka you call for help nga tolina kyewakoze. You call for help. Nofuna omuntu akuyambako. Before or after all that, ngomaze okuyita for help, notandika okukola. Tugenda tandika naki. Tulina kye tuyita ABCs of life. A stands for airway, B stands for breathing, and C stands for circulation. So A, tugenda tandika nalaba airway. Airway, yeah, like, wempewo weyita ogenda mbiri gwaffe. Tuyinawo okuyita mu kamwa, tuyinawo okuyita mu nnyindo. So my friend here ali muka assessinga, has anything blocked the airway? Singa airway nebera blocked, omuntu asobola losing consciousness nazirika. So we are checking if the airway is blocked. If it is blocked, we should remove what has blocked the airway. You can either use your 2 fingers or nofunayo forceps. But for emergency situations, you can use your fingers, you pull it out, okay? So in case it is not blocked, you can do the head tilt, chin, lift. No lifting omutwe, like the way she's doing it practically. So tulina ne kituyita breathing. Breathing okebera omuntu asatya. Is the breathing regular or irregular? You can observe the breathing, ng'otunuulira the chest rise and fall. Awo olabira nti either eli fast, rapid or slow. Oba sekyo, you can check here, you put your ear. Oba era owulira omuntu ng'assa nga n'empewo ekufuuwa kutu mpola mpola. Oba owulira nga omukka gukuba. Ekyokusatu tulina kye tuyita circulation. Engeri omusaayi gye kutambulamu mu mubiri. Singa okwata ku fingers zino eno, you compress them like this. Wezirawo kuleta aka red, kitegeeza the blood circulation to the peripheral parts eri poor. Nesinga compressing away bati nosanga circulation nga fingers turningiddewo red. That means the circulation is a bit good. So if all that is done, ngomaze okebera the peripheral organs, there's no peripheral parts, the arms and the limbs. So, in case you're done with all this, tulina kye tuyita compressions, oba kiyite the CPR. Yes, the chest compressions mwe tugenda okukola. So, you can come. Tulina kye tuyita chest compressions. Omuntu oba ogenda you flex your hands. Yeah? So, tuba tugenda kukola we bati, our hands, oteeke waneno side nga ku sternum. Sternum ke kanene akantu waneno, above here, a little. Okozesa omukono oguli less dominant, gososa then notekako oguli dominant. Gwosinga okozesa gwe gubeera kungulu. So you compress musawo. 2, 3. So you can do 1, 2, 3. the 30 you do 30 compressions, then you bag twice. Ochiddamu repeatedly. This is what we call bagging. Chetuita bagging. Obera. Larita, come here. So you're going to be bagging. Mpola mpola. You do it spontaneously. Onakola walindamu. Then now you can now do the bagging. Then najana compressing. I do it spontaneously. Okola we mlindam. So I guess by the time you do all that, at least emergency help ebe to say, you're good to go.
I want to take the other people to the other studio. As we are still continuing with our health symposium, I would like to hand over to Mariam Businje for the judicial show to the other side so that we can continue with our health symposium. Ladies and gentlemen, these students are from Islamic University in Uganda, Females Campus Kabojja, and in Nansing. We are calling you to come and apply with us so that you can be in January intake. Come and join the winning team. My name is Balige Afan. Have a good day for now and be able to come and sign out again. Mariam Businje, please take over.